So here we're going to show you a lateral hip release in a side lying position. This allows us to really work efficiently glute med, glute min, and even parts of the glute max. So the glute medius and minimus are huge pain generators in hip and lower back. Most clients that you see with hip and or lower back pain, and even some sort of sciatic, pseudo-sciatic type symptoms, will have origins in the glute med min complex. So this is a great technique to really address those tissues. A couple of ways of doing this. So first of all, we have our client on their side, of course, on the edge of the table. This just saves me having to lean over too much. If Kiki was on the middle of the table, I'd be leaning over. So I'm gonna cradle Kiki's knee here. So we want to have a kind of a firm grip with a lot of contact, because if I'm just holding them like this, they'll go floppy and they'll hold their leg for them. So we want them to completely relax. So you can either hold this way, where you come under their shin and grab their knee. We can grab in here and here, depending on the size of those clients. This may work for some people. I sometimes come in here because I can really manipulate the hip even easier. Sometimes you can even come in here and use this type of action, and I'll show you a couple of variations. So I'm going to start here. So Kiki's lower leg is between my body, and I'm going to cradle her knee. So I find a greater trochanter and I move headward. So what I'm going to do, I'm going to AB duct. This is going to shorten those tissues. My weight is on my left leg. I penetrate here and I just step across. Very easy. I'm leaning to my left, lean to my right. Lean to my left. Feels okay? Mm-hmm. And I generally work in 3 stages. So 1, 2, 3. Then move posterior. Same thing. 1, Kiki winced. 2, 3. Here we're just scanning, just checking. Then I move back even more. 1, 2, 3. If you want to manipulate the leg a bit easier, I'll come in here. Now I'm going to use a thumb. I'm still clamping down here. I'm using a thumb. Now I can do a soft tissue release with rotations this way. If I want to work somewhat deeper, using an elbow, I could possibly come up and use my knee here. So my knee is cradling her mid shin. I'm going to be here. And what I do, once I get the contact point, feels okay? Yeah. So I apply pressure, then I take the leg, and then we lower. We bring her back up, get my contact point, so she's resting on my leg. Then I lower. So Kiki doesn't feel like she's relaxing so much here, so I would have to change tact. So I'm really going to grip, I'm not going to use my leg. Apply the pin, this hand, and I just bend my knees and move down. Apply pressure, give it a couple of seconds, maintain contact here, and drop her leg this way. This is actually one of the first soft tissue techniques I learned when I was studying in London at the London School of Sports Massage. It stuck with me for 22 years or whatever it's been. Yeah. Relax. Grip. Fingers, thumbs, knuckles, elbow. If I'm working with a real big, dense, muscular client, I'll have them in this position. So I'll come in here and I'll pin and I'll have them lower their leg themselves. Lower. Actually, just raise your leg yourself, and then lower, and you do it under load. You raise, under load, apply pressure as you lower. For clients who don't want to be that active during their session, that's when you'd come in here, and you would lower for them. Boom, just rocking. Different speeds. Just be sure to cover the whole part of the lateral hip. So slightly posterior of the TFL, like our previous videos, and you work your way around to the PSIS. So you work in this sort of triangle of tissue. Just one more quick glimpse. This posture, hand, stabilize the foot. So this just allows them to really relax, allows them to relax their leg. Find a trochanter, slide off posteriorly, apply the pressure, and here. And with this, you haven't got to go all the way from the top, all the way to the bottom. You can do chunks. I can come in here. The key thing is when I bring the leg up is when I tend to release the pin. Apply, here, release. So whenever I'm shortening the muscle in this technique, I'm releasing the pinning pressure. But this is great technique for those people, like I said, lateral hip pain, deep-seated QL lower back pain. It generally always has a glute minimus medius issue related to it, and it could be weakness as well. These muscles tend to get inhibited and a bit switched off with inhibition and pain. However, they still need to be released and restored, and then strengthened and rehabilitated also.